All right, so get ready for a deep dive today.
Okay.
We're going to be going behind the scenes of a UK medical training document.
Oh, cool.
It's kind of like we're shadowing a doctor
Yeah.
who is preparing for their PACES exam,
Interesting.
and our focus is going to be on a potential case of interstitial lung disease,
Oh,
which can be pretty tricky to diagnose, as I'm sure you know.
absolutely. These training documents, even though they're meant for aspiring doctors, I think they offer a really fascinating glimpse into how doctors approach diagnoses.
Yeah, for sure.
And this case in particular is pretty interesting.
Yeah, so imagine you're observing this doctor as they're examining a patient,
Okay.
and right away you notice that the patient needs supplemental oxygen.
Okay.
A significant amount, actually 4 liters,
Yeah.
even while they're at rest.
Wow.
And they're also clearly having trouble breathing. They're experiencing breathlessness, even just sitting there.
Yeah. So those are some big red flags right away.
Yeah.
And it makes sense why the doctor is immediately considering interstitial lung disease. But of course, as always in medicine, it's not a simple open and shut case.
Ray, before we go any further, can you remind us what interstitial lung disease actually is?
Sure.
I know it's not just like one single condition.
No, you're right. It's not. It refers to a whole group of disorders
Okay.
that affect the interstitium, which is this really delicate tissue
Yeah,
between the air sacs in your lungs.
right.
And when that tissue becomes inflamed or scarred, it prevents the lungs from fully expanding,
Oh, wow.
making it harder and harder to breathe.
So in this case, the supplemental oxygen and the patient's breathlessness,
Yeah,
those are potential signs that there's this underlying lung issue.
exactly. But like we said, there's so many types of interstitial lung disease,
Right.
and each one has different causes. So the doctor's main challenge here is to try to narrow down the specifics, rule out any other possibilities, and ultimately figure out what's at the root of this patient's breathing problems.
It sounds like a medical detective story.
It really does.
So what are the first steps the doctor takes to try to solve this mystery?
Well, the document outlines a very systematic approach,
Right.
which is crucial in any complex medical case.
Yeah.
They begin with some standard blood tests, including some that check for things like autoimmune disorders
Okay.
and vasculitis.
Now, autoimmune disorders, that's when the body's immune system is attacking its own tissues, right?
Yeah, that's right.
Why would the doctor be considering that in a lung case?
That's a good question.
Yeah.
Because you see, certain autoimmune conditions can actually show up in the lungs.
Oh, okay.
So it's all about connecting the dots and considering every possibility.
Yeah.
If those blood tests come back and show signs of autoimmunity, it could point to a very specific type of interstitial lung disease. But if the tests come back normal, that helps the doctor rule out those possibilities and focus on other potential causes.
So each test, even if it's normal, it's giving information and helping to narrow down the diagnosis.
Exactly.
So after the blood work, what's next?
A chest x-ray is next.
Okay.
It's a good way to get a general overview of the lungs. But the real workhorse when it comes to visualizing those really intricate details of the lung tissue, that's going to be a high-resolution CT scan.
Oh, so that's where the high-tech imaging comes in.
Yeah.
And does that CT scan help differentiate between different types of lung problems?
It can.
Okay.
For example, it can help distinguish between obstructive lung diseases, which are those where the airways have narrowed, making it difficult to exhale,
Right.
versus restrictive diseases like interstitial lung disease, where the lungs just can't fully expand, and that makes inhalation difficult.
So in this case, if the CT scan shows a pattern that's consistent with the restrictive lung disease,
Right.
it would support the idea that it could be interstitial lung disease.
Exactly. And then to confirm that even further,
Yeah.
the doctor would also use something called spirometry,
Okay.
which directly measures the lung capacity and airflow.
Right.
So it's kind of like getting the precise reading of how well the lungs are actually working.
Okay, so we've got the blood tests to rule out other conditions and look for specific markers.
Yep.
We've got imaging to actually visualize the lungs and look for patterns.
Right.
And we've got spirometry to assess lung function.
Yeah.
Are there any other tools that the doctor has?
There are. The document also mentions that the doctor would ask a lot of detailed questions about the patient's work history,
Okay.
their occupational history, and also about any medications they're taking.
Okay.
Because certain exposures like asbestos or
Yeah.
certain drugs can actually trigger interstitial lung disease.
Now, asbestos, I know that that's dangerous.
It is.
But how does exposure years ago lead to lung problems now?
Well, asbestos fibers are tiny and they're incredibly durable.
Oh, wow.
And when they're inhaled, they can lodge themselves deep within the lungs.
Oh, gosh.
And they stay there for decades.
Oh, wow.
And over time, they cause chronic inflammation and scarring.
It's like a ticking time bomb almost.
Yeah, it really is a stark reminder that sometimes the cause of a current illness might be something that happened a long time ago.
It's a sobering thought. So past exposures, medications, and even autoimmune conditions.
Right.
It really highlights just how many different things can contribute to interstitial lung disease.
It does. It's kind of like a multi-layered puzzle.
Yeah.
And the doctor's job is to analyze all of the pieces to try to arrive at the most accurate diagnosis.
And I imagine with a complex case like this, it's probably not just one doctor's opinion, right?
No, you're right.
It's a team.
Yeah, the document emphasizes the importance of a multidisciplinary team, or an MDT in these cases,
Okay.
which means that specialists from lots of different fields like pulmonology, radiology, rheumatology,
Yeah.
they all come together,
Uh-huh.
they review the findings, and then they collectively decide what the best course of action is going to be.
That makes a lot of sense. It's kind of like a team of detectives with their
Yeah.
own specialties all working together to crack the case.
That's a great analogy.
Right.
And that type of collaborative approach is especially important when you're trying to figure out the best treatment strategy.
Yeah.
Which, of course, is going to be different depending on what the underlying cause is.
Right. So different types of interstitial lung disease, different causes, different treatments.
Exactly.
A lot to unpack.
Yeah, it is.
But before we do that, I think we should pause here.
Okay.
We'll pick up the case in part 2 of this deep dive.
Sounds good.
Welcome back.
Okay.
We're in the middle of this potential interstitial lung disease case,
Yeah.
learning how doctors figure out the exact cause
Mm-hmm.
and how they decide what the best treatment is going to be.
Right.
And we just finished talking about the importance of that multidisciplinary team,
Yeah, the MDT.
which shows just how complex these cases can be.
It really does. It's not just about looking at the lungs by themselves.
Right.
It's about understanding the whole patient.
Yeah, their overall health, their history.
Right, all those contributing factors.
And speaking of we talked about some of those diagnostic tools earlier. The blood tests, the chest x-rays,
Mm-hmm.
the CT, scans, spirometry. Are there any other tests that might be used in a case like this?
Yeah, there are, especially if those initial tests don't give a clear answer.
Okay.
The document mentions a couple of procedures that can provide some really valuable insights.
Okay.
Although they are a little bit more invasive.
Okay.
One of them is called a bronchoscopy.
Ah, bronchoscopy.
Yeah.
That's where they insert a thin tube with a camera into the lungs, right?
Right?
I think I saw that on a medical show once.
Yeah.
Seems pretty intense.
It can seem that way, but it's a pretty common procedure.
Okay.
It's generally safe, and it allows doctors to directly see the airways.
Oh, wow.
And importantly, it lets them take biopsies of the lung tissue
Okay.
or collect fluid samples.
So it's like getting a microscopic view of what's happening in the lungs.
Exactly.
But I imagine they wouldn't do a bronchoscopy right away.
No, no.
Are there certain times when it would be especially helpful?
Yeah, a bronchoscopy would be really helpful if the other tests aren't clear.
Okay.
Or if they think there might be an infection or inflammation that could be contributing to the interstitial lung disease.
Okay.
It can also help rule out other conditions that look like interstitial lung disease.
So it helps narrow down the diagnosis.
Exactly.
So that's one procedure. Are there any others?
Yeah, in really rare cases, when they still can't figure out the diagnosis,
Hmm.
they might consider a surgical lung biopsy,
Oh, wow.
which means they take a small piece of lung tissue and look at it under a microscope.
Okay.
It's definitely the most invasive option,
Yeah.
but sometimes it's the only way to get the most accurate information.
Okay. So let's say the doctor, or I guess the whole team,
Yeah, the MDT.
they've figured out what the diagnosis is. What happens next?
Well, then the next step is to come up with a treatment plan
Oh.
that's specifically tailored for the type of interstitial lung disease they have
Right.
and for the individual patient's needs.
Okay, before we get into those specifics, I have kind of a bigger question.
Okay.
Can interstitial lung disease be cured?
That's a great question. And unfortunately, for most types of interstitial lung disease, there's no cure.
Oh, okay.
But that doesn't mean there's nothing we can do.
Okay.
The focus of treatment is really on slowing down how fast the disease progresses, managing the symptoms,
Okay.
and trying to improve the patient's quality of life.
So even though they can't reverse the damage that's been done, they can help people live better with it.
Yeah, exactly. And the way they do that is going to depend on the underlying cause.
Right.
We talked about some medications that can actually trigger interstitial lung disease.
Yeah.
In those cases, sometimes just stopping that medication
Right.
might be enough to stop the disease from getting worse.
Oh, so sometimes it's just a matter of finding and eliminating that trigger.
Exactly.
But what about the cases where it's not that straightforward?
Right.
Like in our hypothetical patient here where the doctor thinks it might be idiopathic pulmonary fibrosis,
Yeah.
which I understand is a particularly tough one.
You're right. Idiopathic pulmonary fibrosis, or IPF.
Yeah.
IPF, it's a challenging one. It's characterized by this progressive scarring of the lung tissue.
Right.
And the cause, well, as the name suggests, is idiopathic, meaning we don't know what causes it.
So there's no smoking gun.
Right.
But are there treatments specifically for IPF?
There are. In recent years, they've approved 2 drugs specifically for IPF,
Oh, wow.
pirfenidone and nintedanib.
Okay, so new tools in the toolkit.
Yeah.
And how do those drugs work? Do they reverse the scarring?
Unfortunately, they don't reverse the scarring that's already there,
Oh.
but they have been shown to slow down the progression of the disease.
Okay.
They work in slightly different ways, but they both target those processes involved in fibrosis.
Okay.
So basically trying to put the brakes on the scarring process.
So not a cure, but a way to slow things down.
Exactly.
What about other types of interstitial lung disease? Are the
Oh.
treatments similar?
For some types, yes.
Okay.
Corticosteroids, which are really powerful anti-inflammatory drugs, they might be used to try to reduce inflammation in the lungs.
Those are the heavy hitters of the anti-inflammatory world.
Exactly. But they can have some side effects.
Yeah,
So they're not for everybody,
right.
and they need to be carefully monitored.
Right.
And in some cases, they might prescribe immunosuppressant medications, especially if they think there might be an autoimmune component involved.
So steroids to reduce inflammation,
Yeah,
immunosuppressants to control the immune response.
right.
Sounds like a real balancing act trying to find that right treatment.
It really is.
But medication isn't the only option, right?
No, your medication is only one piece of the puzzle.
Okay.
It's also really important to manage those symptoms.
Yeah, the cough, the fatigue, shortness of breath.
Exactly. You want to try to improve their quality of life.
Right.
And pulmonary rehabilitation programs can be really helpful for that.
Pulmonary rehab, I've never heard of that.
Oh, yeah, it's great.
What is it?
It's basically a whole program
Okay.
that's designed to help patients live better with their lung condition. It usually includes things like exercise training,
Okay.
breathing techniques, education, and even psychological support.
So it's not just about the physical aspects of the disease,
Right.
but also the mental and emotional toll it takes.
Yeah, exactly. Interstitial lung disease can have a huge impact on someone's life.
Yeah.
It can affect their ability to work, to socialize, to do the things they enjoy.
Yeah.
So pulmonary rehab gives them the tools and strategies
Okay.
to cope with those challenges and improve their overall well-being.
So it's a holistic approach. It addresses the whole person.
Exactly.
Yeah.
And it really highlights something important.
Okay.
Even though a diagnosis of interstitial lung disease can be really scary,
Yeah.
there are resources and treatments available
Yeah.
to help patients through it.
That's good to hear. But before we go too far, I think it's important to talk about early detection.
Yeah.
If there's no cure, catching it early must be really crucial.
You're absolutely right. Early detection is key.
Okay.
The earlier you diagnose interstitial lung disease,
Mhm.
the sooner you can start treatment.
Right.
And that can potentially slow down the progression of the disease
Okay.
and preserve lung function.
So let's talk about those early warning signs.
Yeah.
What should people be looking out for?
Okay.
What are those red flags that tell you this might be something more
Yeah.
than just a cold or, just being out of breath from exercise?
Well, one of the most common and often one of the earliest symptoms
Yeah?
is shortness of breath, especially during physical activity.
Okay.
Now, of course, it's normal to get a little winded after you exercise,
Yeah.
but it's all about the context.
So it's not about avoiding exercise altogether,
No.
but it's about paying attention to any big changes in your breathing.
Exactly. If you're suddenly having trouble catching your breath doing things that used to be easy,
Right.
or if you find that you're gradually having to reduce how much you can do,
Okay.
that's a red flag. It's all about noticing changes from your baseline.
Okay. Shortness of breath, especially if it's new or getting worse.
Yeah.
Anything else?
Another really common symptom is a dry cough that just won't go away.
Okay.
Not the kind you get with a cold or the flu,
Right.
but a cough that just lingers.
So if it goes on for weeks or even months,
Yeah, that's a concern.
is there anything specific about that kind of cough that's different from other coughs?
Yeah, it's often described as dry,
Yeah.
meaning it doesn't produce a lot of phlegm,
Okay.
and it can be especially bad at night
Okay.
or first thing in the morning.
Those are some subtle symptoms.
They are.
I can see how people might just ignore them at first.
Yeah.
Are there any other signs that are maybe more obvious?
Yeah, fatigue and unexplained weight loss can also be signs of interstitial lung disease.
Okay.
And some people experience chest pain or discomfort,
Mm.
but that's less common.
It seems like those early symptoms can be pretty general
They can.
and could be mistaken for other things.
Yeah.
Is that why early detection is so difficult?
It definitely is. Interstitial lung disease can be hard to spot in its early stages, so it's really important to pay attention to your body
Hold
and
on.
see a doctor
Yeah.
if you have any symptoms that are persistent or unusual.
Trust your gut. If something feels wrong,
Yeah.
get it checked out.
Exactly.
Now, we've talked about the symptoms, but are there certain people who are more likely to get interstitial lung disease?
Yeah, there are a few risk factors to think about.
Okay.
Smoking is a big one,
Okay.
as it is with lots of lung conditions.
Right.
But exposure to certain things in the environment or at work
Yeah.
can also play a big role.
So people who work in industries where they might be exposed to asbestos,
Yeah.
silica dust, or certain chemicals,
Yeah.
they need to be really careful.
Exactly. And it's not just about current exposure.
Wow.
Sometimes those past exposures can come back to affect you years or even decades later.
So it's really important to have a detailed medical history.
It really is.
Are there any other risk factors?
Yeah, genetics can also play a role.
Okay.
Some types of interstitial lung disease run in families. So if you have a family history of the condition, you might be more likely to get it.
Okay.
And as with many health conditions, age is a factor too.
Mm-hmm.
Interstitial lung disease is more common in older adults,
Right.
but it can happen in younger people too.
So it's a mix of things: genetics, the lifestyle, environment, work, and age all play a part.
Exactly.
Seems like awareness is really important,
Yeah.
not just for people in general, but also for doctors and nurses.
You're absolutely right. The more we all know about interstitial lung disease,
Uh-huh.
about its risk factors and those early symptoms,
Mm-hmm.
the better we'll be able to detect it early and treat it effectively.
Well, this has been a really informative deep dive.
has.
We've gone from that doctor's office,
Yeah.
seeing how they figure out the diagnosis,
Mm-hmm.
to the lab exploring the science behind the disease,
Mm-hmm.
and even to the rehab center,
Right.
learning about how to manage the condition and make life better for people living with it. And I think the most important thing we've learned is that even though interstitial lung disease is a serious condition
Right.
and often gets worse over time,
Yeah.
there is hope.
Absolutely.
Early diagnosis, the right treatment and supportive care can really make a big difference for patients.
They really can.
So what we've come to the end of this deep dive,
Yeah.
it's clear that the research into interstitial lung disease continues.
Yeah.
The search for better treatments and hopefully someday a cure.
Absolutely.
And if you're interested in learning more about lung health
Yeah.
or want to explore some other interesting medical topics,
Mm-hmm.
be sure to check out our other deep dives.
Right.
There's a whole world of knowledge out there just waiting to be discovered.
There is.
And as always, a big thank you to our expert for sharing their insights
You're welcome.
and for guiding us through this complex topic.
My pleasure.
We hope you found this deep dive helpful and empowering.
I hope so.
And from all of us here at the Deep Dive, thanks for joining us.
Thanks for having me.
Welcome back to the final part of our deep dive on interstitial lung disease.
Okay.
We're going to be talking about early detection and how crucial it can be.
Yeah, absolutely. It's super important.
So let's talk about those warning signs, those early warning signs.
Okay.
What should people be looking for?
Right.
What are some of the red flags that might tell you that this is something more serious
Yeah.
than just, a cold or just being out of breath from exercise?
Well, one of the most common and often the earliest symptoms is shortness of breath,
Okay.
especially during physical activity.
Right.
And of course, it's normal to get a little winded after you've been exercising,
Yeah.
but it's the context that really matters.
So it's not about avoiding exercise altogether,
No, not at all.
but it's about noticing any changes.
Yeah. Any significant changes in your breathing?
Right. If you're suddenly struggling to catch your breath,
Right.
doing things that used to be easy for you,
Exactly.
or if you're having to scale back your activity level.
Yeah, if you notice that you're gradually having to do less and less,
Okay.
that's a definite red flag.
Okay, so shortness of breath, especially if it's new or if it's getting worse.
Right.
What else?
Another really common symptom is a dry cough that just won't go away.
Oh, a persistent cough?
Yeah, not the kind you get with a cold or the flu.
Yeah.
But a cough that just seems to linger.
So if it's hanging around for weeks or even months,
Yeah, exactly.
Yeah.
That's a cause for concern.
is there anything particular about this cough that makes it different from other coughs?
It's often described as dry,
Okay.
which means it doesn't produce much phlegm.
Okay, no mucus.
And it can be particularly bad at night or first thing in the morning.
It's interesting that those are pretty subtle symptoms,
They are.
and it seems like it would be easy to just kind of dismiss them.
Yeah, I think a lot of people do.
Are there any other signs that might be a little more obvious?
Um, fatigue and unexplained weight loss can also be signs of interstitial lung disease.
Okay.
And some people have chest pain or discomfort, but that's less common.
So it seems like the early symptoms are kind of general
Yeah,
and could be mistaken for other things.
exactly.
Is that why early detection is so hard?
It definitely is one of the reasons.
Good.
It can be tough to spot in those early stages.
So it sounds like it's really important to listen to your body
Yeah.
and talk to your doctor
Absolutely.
if anything seems off.
If you have any symptoms that are persistent or unusual.
Right. Trust your gut.
Exactly.
Now, are there certain people who are more likely to get interstitial lung disease?
Yeah, there are some risk factors.
Like what?
Smoking is a big one,
Of course.
as it is for so many lung conditions.
Right.
But exposure to certain things in the environment or at work can also be a factor.
So people who work around asbestos
Yeah.
or silica dust or certain chemicals.
Exactly.
No.
They need to be extra cautious.
And it's not just about being exposed to those things now.
Whoa,
It's also about past exposure.
Yeah, sometimes exposures from years ago can come back to cause problems.
That's pretty scary.
It is.
So a thorough medical history is crucial.
Really is. Anything else?
Genetics can also play a role.
Oh, interesting.
Some types of interstitial lung disease run in families.
Wow, so it can be hereditary?
It can. So if you have a family history of it, you might be more at risk.
And I guess age is also a factor.
Yeah, age is definitely a factor,
As with a lot of things.
as with most health conditions.
Interstitial lung disease is more common in older people.
It is more common in older adults, but it can certainly happen in younger people too.
So it's a mix of things: genetics, lifestyle, environment, work age.
Yeah, it all contributes.
So it seems like awareness is really key.
Absolutely.
Not just for individuals, but for healthcare professionals as well.
The more we know about interstitial lung disease,
Yeah.
the better we'll be able to detect it early and get people the treatment they need.
It's been a fascinating deep dive.
It has been.
We've learned so much about interstitial lung disease.
We've covered a lot of ground
From those early symptoms.
to the different types of interstitial lung disease and all the different treatments that are available.
Yeah.
And I think one of the most important things we've learned is that even though it's a serious condition
Yeah.
and it often progresses over time,
It can.
there is hope.
Absolutely.
Early detection and appropriate treatment can make a big difference.
They really can.
Well, we've come to the end of our deep dive today,
Okay.
but we hope you'll continue to explore the world of lung health
Yeah.
and all those other fascinating medical topics out there.
There's so much to learn.
As always, a huge thank you to our expert for sharing their knowledge and insights.
My pleasure.
And from all of us here at The Deep Dive, thanks for listening.